don't owe anybody an explanation. And if somebody continues to put pressure on you to have a drink, you can actually always walk away. Just take your soda water and lime, head over to the dance floor, start chatting to other folk that are not going to put pressure on you. We're seeing a huge rise of ketamine addiction. So a 35% increase in the number of people coming to us with ketamine addiction. But sometimes we also see kind of other more unusual addictions as well. So I've seen patients with sex and love addiction. Why do people put pressure on you to drink? And why are they uncomfortable when you don't drink? I think people feel safer when they're behaving in the same way as all of their peers.
Hi everybody, it's dry January, which means it's time to detox. However, there is a bit of temptation to go back into old habits, which is why I'm here today with Dr McLaughlan, who is one of the top psychiatrists at the Priory and the co-founder of the app Curb.
Thank you, great.
So Dr McLaughlan, can you tell me a wee bit about your role at the Priory and what you do there?
Yep, so I am a consultant psychiatrist and I specialise in addiction. I do a bit of ADHD work as well, and I see people with all sorts of kind of mental health problems, difficulty struggling, stress, anxiety, burnout, people from all walks of life. And
what do people come to you the most with? What are the kind of main addictions that people tend to need help with?
We see people with all sorts of different types of addictions. The most common one, 80% of our patients come with alcohol addiction, and then the other 20% is actually cocaine addiction. We're seeing a huge rise of ketamine addiction, so a 35% increase in the number of people coming to us with ketamine addiction. But sometimes we also see kind of other more unusual addictions as well. So I've seen patients with sex and love addiction, shopping addiction, gambling addiction, even actually sometimes people come for smoking addiction, nicotine addiction, so all sorts.
Can you tell me about the percentage of your patients that do have alcohol addiction? Is that one of the most popular reasons that they come to you?
So at the Priory overall, 80% of the patients who are on the addiction treatment programme are there for alcohol addiction. About 20% of them are there for cocaine addiction. But we're also seeing a huge increase in the number of people coming to us because of ketamine addiction. And sometimes we see other less common addictions like gambling or sex and love addiction, shopping addiction even nicotine addiction, people coming for support with smoke cessation.
And going back to alcohol addiction, why do you think it's so common for people to kind of go out and, there's just so much kind of social pressure for people to drink? Why do you think that is?
Yes, and we're both Scottish, obviously, so we probably have kind of a similar shared experience of growing up, where it was a cultural norm to drink, and there's certain kind of communities that are even more vulnerable. So anybody from well, it depends who you're surrounded by. Actually, it's one of the things that really influences your drinking behaviour, and also what you've observed your family and your parents, what their style of drinking has been like. There's a genetic predisposition as well for alcohol misuse as well. But a big part of it is peer pressure and social pressure. There's a professor who I'm a big fan of, Professor David McLaughlan, who wrote a paper a couple of years ago, and he talked about the 4 different reasons why people drink. And those 4 reasons are to conform socially, to enhance an experience that's already really good, for social cohesion, so to have a shared positive experience in a group, but also to cope. So that could be because of insomnia, anxiety, depression, low mood. So for every individual, there's going to be really complicated, diverse reasons why they drink.
So if I were to be in a social situation and I said, I don't drink, people's usual reaction is, why not? Or why just have one? And then when you do end up, conforming, it's like, yes, you're drinking now. Like, why do you think that is?
Yeah, so it's interesting. Why do people put pressure on you to drink, and why are they uncomfortable when you don't drink? I think people feel safer when they're behaving in the same way as all of their peers. And there's almost like a kind of a group thing, kind of herd mentality. For a lot of people, that makes them feel safer. And if you're behaving differently, it forces them to question maybe why they are drinking. So if somebody says to you, why aren't you drinking? Then you could always turn the tables on them and say, well, why are you drinking? That's one of my top tips.
Yeah, exactly.
But why does it make other people feel uncomfortable when you're not drinking? Again, you could turn the tables and you could actually ask them that as well. You could say, well, how does it change your evening? Why is it necessary for me to drink? But ultimately, I think it goes back to that idea that people feel safest when they're all doing the same thing, and it reassures them that their behaviour is also okay and correct.
If I were to be in a situation and I wanted to say, I don't drink, what are some good ways to kind of, make that clear, not give in to pressure?
So first of all, if you're in a social situation and you don't want to drink, I think you've already started in the right foot, because you've said, I'm not drinking. So you've actually declared your intentions and you've let people know, and it sounds like you've done it in quite a nice way. And then that probably prevents lots of awkward situations as well, where people pour glass into your wine, and that happens in restaurants where a waiter will just automatically assume. So by starting off that situation, by making that kind of declaration of your intent known, then you're already on the right foot. And sometimes you can do things like even removing the wine glass from your place setting. So you've actually already done the first thing right. And then the rest is actually about, I guess, how you interact with people if they then apply that pressure. And I've got 4 little tricks, and it's almost like personas that you can adopt. And in my clinic at the Priory, I sometimes do role play with my patients, and on the app Curb, we also have interactive exercises to help people to practice adopting these different types of personas. Because when you practice something, you're more likely to, you're not going to be caught off the hoof, you're not going to have to think on your feet, you're more likely to avoid drinking when you don't want to. So those 4 non-drinking personas that I encourage my patients and our users on the app to adopt. One is called the table turner. So I mentioned that earlier, where you actually turn the question around on the other person, or you distract them and you say, well, actually tell me what you're drinking, or why does it matter if I'm not drinking? And you can do it in a playful way as well, but sometimes just taking the heat off yourself, or asking somebody else around the table a question. The other one is the little white lie. So with the little white lie, you could say something like, I'm not drinking tonight because I'm on antibiotics.
Yeah, that's my usual one.
I'm driving home tonight.
Yeah.
And people often don't challenge you, and it'll stop there.
Yeah, because it's medical related and it's quite personal, so they don't want to kind of probe at it.
Absolutely, absolutely. And then the other drink refusal persona that I sometimes adopt as well is the joker. So if somebody says to me, David, why aren't you having a beer? I might say something like, I have 2 brain cells left after the week I've had, and I don't need beer to kill off the last 2.
Yeah. Get light-hearted.
Yeah. You can make a joke of it, or I'm a terrible dancer as it is. If I drink wine, it's just going to get worse. And again, a lot of people will kind of pick up in those cues. And then finally, if somebody's being really persistent with you and saying, why aren't you drinking? The last approach is just to be direct and to be honest and say, look, when I drink, I sometimes behave ways I don't want to behave. I get really anxious the next day, or I'm doing dry January, or I'm actually running a marathon next month, or I'm pregnant. You can, whatever the reasons are. Yeah, well, I mean, that will start the conversation up, won't it?
Yeah, okay. Yeah, cool.
And
that's a good idea.
The other thing is, you don't owe anybody an explanation. And if somebody continues to put pressure on you to have a drink, you can actually always walk away. Just take your soda water and lime, head over to the dance floor, start chatting to other folk that are not going to put pressure on you.
Good.
You don't owe anybody an explanation.
Yeah, nice. Can you tell me a bit more about the app Curb that you've co-founded?
So Curb was co-founded by myself and Jo Barrow, who is Innovate UK 2023 Women in Innovation Award winner. We wanted to make it easier for people to change unwanted drinking behaviour. And so there was evolving technology that we were really excited about. So we won a grant from Innovate UK to take data from wearable devices, digital phenotypes, and to actually predict when people were most likely to drink alcohol and to have these unwanted drinking behaviours. And what that meant is it gave us the opportunity to intervene and to prevent these unwanted drinking behaviours. And we're hoping that lots of people will use it.
What is your goal for the app, and what do you and your business partners want to achieve from it?
At Curb, we're on a mission to celebrate healthy behavioural change and to prevent unwanted drinking. So we just want to make this app available and accessible for as many people as possible, to prevent people from actually becoming addicted and to celebrate this healthy behavioural change. So for Dry January, we're actually giving away free lifetime access to anybody who downloads the app during January 2024.
That's good of you. Better get downloading then. And I guess for somebody during dry January, maybe some people don't want to just cut out booze completely because I guess it can't be avoided in some situations, work events, and I guess they just want to cut down a bit. So what advice would you give to someone that just wants to cut down a bit rather than giving it up completely?
This is a really great question, because a lot of people find the idea of quitting drinking really, really frightening, even if it is just for 1 month. And I think if it is really frightening to give up alcohol for 1 month, I think that's a really interesting thing in itself, and that's something probably to explore. However, I am always really, really willing to talk to people about how they can reduce their drinking. It doesn't have to be about quitting drinking. And so actually that's why with Curb, we talk about changing unwanted drinking behaviours. And in my clinic at the Priory, again, I work with people who've got all sorts of different drinking goals. I think what is key is to reflect on your drinking behaviour. What's your relationship with alcohol like? Where, when, why, with whom do you drink? What purpose is alcohol serving for you? Are you drinking to enhance an experience, or are you drinking to cope with something like anxiety or insomnia? What purpose does alcohol serve for you? I think once we've had this kind of conversation with ourselves, or with somebody like me, an addiction psychiatrist or a counsellor, or even a friend or a family member, then you can set yourself your goal. What is it that you want to change? And so that's when I would work with an individual at the Priory, for example, and I would say, well, look, if this is your goal, how is it going to happen? Then the other thing as well, if somebody tells me they want to cut down their drinking, I would say, okay, so what will your new boundaries be? Because often people who drink too much is because they don't have clear boundaries. So there's no rules as to where, when, why, with whom, how much, and why they will drink alcohol. And one of the features that you see is this total loss of control. And actually, they're not in control of their drinking. The drinking is in control of them. So boundaries and having those rules about where, why, when, with whom you will drink is one of the things that's really important if you're looking just to reduce your drinking.
Good. Do you have any inspiring stories you can tell me about anybody that you've helped while working at the Priory?
I have so many inspiring stories. And I don't want to cry on camera because sometimes I do that. But there's so many inspiring stories, because I think the thing is when people drink, and it's not even addiction, it's just kind of misusing alcohol, just getting too drunk or binge drinking, it doesn't just affect that one person, it actually affects everybody around them. There's a ripple effect, so it can affect their partner, their family, their colleagues, and it can be really emotional when that person sees the benefits that quitting drinking has on people around them, and they have this sudden realization of all the harm that they've been doing and everything they've missed out on, but also this joyful celebration of everything that they're getting back. So sometimes people will talk about saying when you stop drinking, you quit drinking, but you regain your life.
Yeah. Oh, that's nice. Very true as well, because drinking does, I guess it's not just you that affects, it affects everyone around you. So yeah. Can you tell me about a client whose journey has inspired you the most?
I actually have a couple of clients who have had similar journeys. Often they come to me in my clinic when something really bad has happened. They have had an issue with their relationship. Maybe they've had a big argument, or they've crashed their car, they've got into trouble with police, or they've got into trouble with work, and it could be something really significant for misconduct at work. And actually their whole life just feels like it's fallen apart because of something that has happened. There's been a trigger event, and they come to me in crisis. But what I've seen repeatedly as well is that people find it so terrifying to give up alcohol. And so I have had many patients where I work with them to help them to put boundaries in place so that they can regain control of their drinking. So having rules like, how many days per week are they going to drink? With whom are they going to drink? What type of alcohol will they drink? And what is the maximum that they'll allow themselves on any one day? And I'm always happy to have that conversation with people and work with them according to their goals. But I'm open-minded, and I also ask my patients to be open-minded. And often people will give up alcohol for a couple of weeks or a month, and they actually realise their life is so much better. So those patients I've told you about where they've come to me in crisis because they've actually lost their job, or their husband's threatened to leave them, or they've got into trouble with police and they feel like their life has fallen apart. I've seen them work with me and regain their life and consolidate their relationship, see their career get back on track, and actually get a lot physically fitter and healthier, start sleeping better at nighttime, feel less anxious, their skin clears up, they feel
it's all getting better. Yeah,
there's so many health benefits of drinking less.
Yeah, not smashing up your liver. It's like, I actually have normal skin, and like, I don't feel anxious all the time. So
I think the carrot is always much more effective than the stick. So I talk about with my patients how much better their life is going to get, and I'm going to help them get there. And it's about looking towards the future. It's going to be so much better. And it's I know it's scary and it is frightening to change any behaviour, especially when alcohol's actually giving you something. So it's always worth acknowledging how is alcohol serving them? And what I do is I try to understand that, and then I will replace that with something that's better. So if the alcohol's helping them kind of manage their boredom, I'm going to give them something more exciting than alcohol. I'm going to introduce them to CrossFit or
get that thrill from something else, like healthier habits, like healthier addictions. So that's the way to do it. Yeah, and just touching on I guess how alcohol affects work life. I guess people in London, it's normal for them to kind of go out for drinks, after work. And are there any kind of scenarios where people do just over drink at work and they get into trouble in work, and how would you kind of help them out in that situation? Yeah,
over drinking at work is really, really common, and it's a really common reason why people will come to see me in the Priory, and that could be because of misconduct or just embarrassment. And I'm always really sympathetic, because often there's many workplaces and industries where alcohol is really encouraged. And it's difficult to say no if it's your boss that's encouraging you to drink, or if it's a client.
Will I get fired if I don't drink this?
People worry. Will I get my bonus if I turn down a beer from the boss? So it's a really common problem in the workplace, and that's something that it would be great to work with employers to see if we can try and change that.
That sounds good. And I guess any tips in those situations as well, in work situations, how would you kind of decline, your boss putting a beer in front of you? What would you say in that situation?
So again, doesn't matter who's offering you a beer that you don't want. If you don't want that beer, you don't have to drink the beer. And again, going back to those drink refusal personas, you could be the joker, you could be the little white liar, you could be the diplomat, so reasoning with them, you could be the table turner, so you turn the question back onto them or distract them with another question about somebody else, or you can just be really direct and you can just say, I'm just not drinking, and you don't
throw it off the table.
Any further explanation. And come see me in the Priory, and we can practice those drink refusal skills, or you can also get free access anytime you want, 24/7 day on the app.
Amazing. Good. So you mentioned earlier that AI was quite a big part of your app, Curb. So can you go into more detail about that, please?
Over the last year or so, we've been lucky enough to be been supported by the government's research and innovation body, Innovate UK, and they've awarded us grants, which has enabled us to integrate data from wearable devices like your Fitbit, your digital phenotype from your phone, and also some user inputs into the app, and actually start to learn when you are most vulnerable to unwanted drinking behaviours. So one of the things we found was that you were more likely to binge drink when you were sleep deprived and you hadn't slept, or when your heart rate variability decreased, and that's a measure of how stressed you are. And also actually if your step count reduced as well. So if you're inactive, that predisposed you to binge drinking. And this stuff really excites me, because I want to live in a world where we can prevent people from getting sick and prevent people from being unwell and developing, mental health conditions or addiction. And one of the best ways that we can predict is using AI, machine learning, to understand when you're most vulnerable, offer you that in the moment support, and that the intervention that's going to stop you from drinking.
And what's the process of the app then? I guess, they've got the app, and then do they communicate with your team as well? Like, do they message you? Like, how would they get in touch or get the support?
This version of the app, we actually haven't integrated any of the AI or machine learning in it yet. That's actually still in development, and that's what was funded by Innovate UK. But the version of the app just now, it's got loads of tools, tips, exercises. We also allow people to track and celebrate their success, but also to compare themselves against national averages as well, which people find really interesting. It's all about giving people a kind of a sense of awareness, helping them to set goals, set their intentions about how they want to change their relationship with drinking, but also celebrate with them, because it's something that you should feel really proud of. Just like if you've been on Strava, Peloton, and you've got these health and fitness achievements. I think if you've managed to quit drinking for a month, that's something that you should be really proud of.
Exactly.
And we also help you to track things like how much money you've saved.
Geez, wouldn't want to think about that.
Exactly.
Yeah, night out. I guess as well, it's good in the sense that maybe people are a bit embarrassed about getting face-to-face help and talking about it. So the app's a good tool just for people to kind of, do it themselves. And
do you know what? This is the other thing actually, that when we were developing this app, I spoke to so many different people, like doctors, therapists, patients, just my friends, my family, employers. There's so much stigma about unhealthy drinking and addiction. That's a word I actually don't even know how I feel about that word, addiction. So for me, this is about celebrating healthy, positive behavioural change. And one of the things that I have found when I spoke to employers, potential customers in the employee wellbeing market, so many employees have harmful, problematic drinking, but they don't want anybody else at work to know. They don't want HR to know. They don't want occupational health to know, because they're worried about losing their jobs. So you have police officers that don't tell their line manager, but they still go to work with a hangover. And you could have a surgeon who could have a hangover. People are frightened of losing their job. If you work in the traffic, if you work in transport, people are frightened of the stigma losing their job by asking for help. But this is why having a really discreet app, you could have it on your phone, nobody needs to know about it, getting access to that help or support, not having to go to an NHS drug and alcohol clinic where you maybe don't relate to those other people. It's just another way to make help and support more accessible, and to celebrate that positive, healthy behavioural change.
Because I guess if people did go through the NHS, how long would it take for them to get the right support, do you think?
So I actually love the NHS, and I worked in the NHS for 12 years, and they do so much amazing work. I think there's lots of people find it very difficult to get the support they need in the NHS, because the waiting list times are very, very long, and the threshold for getting access to support is actually quite high. So there's lots of people who are still drinking in harmful ways that don't get help from the support from the NHS, because they're not meeting the thresholds, or the waiting list times are too long, or they're just flying under the radar, and they don't realise it's a problem, they don't think it's a problem, and they don't ask for help.
So before you go, I would like to know a couple of tips that you have for anybody that might be doing Dry January this year.
Okay, so my first top tip is to check in on yourself. How much are you drinking at the moment already? why are you drinking, with whom, and what is your relationship with alcohol like. Have a really honest reflection with yourself, maybe even ask for kind of feedback from people around you. Then if you're doing dry January, declare your intentions, tell folk that you're doing it. They're less likely to put pressure on you, they're more likely to support you, they might even do it with you as well, and that makes things easier if we do things in a group as well. So let people know that you're doing it. Thirdly, set your as well as setting your goals, set your intentions. I suppose understand what are the risks, when are you most likely to slip up, understanding your drink triggers and the drinking cues for you. And then, I've kind of merged this all together, but having a plan. So if you encounter any of these drink triggers or drink cues, how are you going to manage them? How are you going to handle it? Because if you have a plan, you don't have to think on the spot. You can just follow the plan. You can go on autopilot, and it makes it much easier to avoid drinking that you don't want.
Good. And one more, just so it's 5.
One more? Yeah. And then I guess my final tip is to be really proud of your success or any healthy behavioural change. I think people should shout off the top of the rooftops, and if you're doing something that is improving your health and well-being, you should really celebrate that. It's hard, and when you've done something really hard, you deserve to be rewarded and that to be recognised. So if you're doing dry January, tell everybody about it.
Thank you so much for your time, Dr McLaughlan, and giving me all your tips for dry January and changing drinking habits.
It's a pleasure. Thank you for having me.
So if you're curious about changing your drinking habits, we've got all the links in the description for the Priory and Curb the app.